What are the visual types of bladder stones? Imagine looking inside the bladder and seeing different kinds of stones, each with its own unique look. Bladder stones, also called bladder calculi, come in various shapes, sizes, and colors, depending on what they are made of and how they formed. The most common type is calcium-containing stones. These are usually dense, hard, and appear white or off-white. They often show up clearly on X-ray images because they are radiopaque, meaning they block X-ray beams. Calcium stones can be made of calcium oxalate or calcium phosphate, and their surface can be smooth or rough, depending on how they grew. Next, there are struvite stones, which are linked to urinary tract infections caused by bacteria that split urea. These stones tend to be larger and irregular in shape. Sometimes they form branching structures called staghorn stones, which look like deer antlers, especially in the kidney. In the bladder, they may look rough and uneven. Struvite stones are also radiopaque but often less dense than calcium stones, giving them a somewhat different appearance on scans. Uric acid stones are another type. They usually appear yellow to reddish-brown and are smoother in texture. Unlike calcium stones, uric acid stones are radiolucent, so they do not show up well on standard X-rays. They tend to be smaller and more uniform in shape, often round or oval, and can sometimes be mistaken for other small, smooth objects. Cystine stones are less common and are linked to a genetic condition called cystinuria. These stones are typically yellowish and have a waxy look. They can be smooth or have a crystalline surface, and they are moderately radiopaque, meaning they show up on X-ray but not as clearly as calcium stones. Many bladder stones are made of a mixture of different minerals, which makes their appearance quite varied. These mixed stones may have layered structures with different colors and textures, giving them a patchwork look. Size and shape also matter. Small stones are often smooth, rounded, and may pass through the urinary tract without causing symptoms. Larger stones tend to be irregular, rough, and can cause irritation or blockages. They might have jagged edges or layered, laminated surfaces from gradual growth. Some stones form directly in the bladder, often in children or in areas with specific health issues, and are usually small and multiple. Others form because of abnormalities or foreign objects like catheters, leading to irregular shapes that stick to these materials. Stones that originate in the kidney and then move into the bladder are called migratory stones. These are often larger and smoother because they pass through the urinary tract, which can wear down their edges. From a bladder health perspective, recognizing the visual type of a bladder stone can give clues about what caused it. For example, infection-related stones like struvite may suggest ongoing urinary infections, while calcium stones could be linked to diet or metabolic issues. Chronic irritation from stones can increase the risk of bladder inflammation and, over time, may be associated with bladder cancer. That's why identifying the stone type helps doctors decide on the best treatment and prevention strategies, like managing infections, relieving obstructions, or monitoring for complications. In summary, bladder stones look different depending on what they are made of, their size, and how they formed. They can be smooth or rough, small or large, and vary in color from white to yellow or reddish-brown. Recognizing these visual differences helps healthcare professionals understand the underlying causes and how best to treat and prevent future stones. Always consult a healthcare provider for personalized advice and proper diagnosis.